Hey everybody, welcome to Fleet Friday. Today we're going to go over Med 1.
Aerial, medic, response.
Heavy working fire, got heavy smoke from Island Ranch and Broadway. Go ahead and upgrade the car. Copy. We got 4 buildings involved at this time. Collapse on 3 of them, and second alarm.
Second alarm.
Rescue 34, Tower 45, Engine 22, Engine 14, Engine 44, Engine 15, Medic 34, Medic 44, District 1, Battalion Chief 2, Safety 18, Medcom Ops 14, Second Alarm Structure Fire.
My name is Ryan Knutsen. I'm the C-Shift District EMS Supervisor. This is our vehicle out of Med 1, and we're stationed at Station 34 in Lone Tree. Today I'm going to show you the vehicle and tell you a little bit about what we do. So this is a 2016 Ford Expedition. Let's open it up and see what we have on the inside. It's a pretty standard SUV. We have radios in here. We have a screen. We call it an MDT. What that does is it gives us information on calls that we need to respond to. It gives us maps there, some important information that we may need to decide on which route to go and what calls to respond to. We get all that information from our dispatch center. As you can see, all the radios I think you just showed there, and you know, we have to talk to other units and our dispatch center. Sometimes we have a lot of commotion going on. So let's open up the back side here. I'll let you get in there with the camera, take a look. Variety of things in here. I'm going to point out we have a heart monitor here. This is we call it a life pack. We're able to put this on in case somebody's having symptoms associated with chest pain, abdominal pain, anytime we ever want to see what somebody's heart's doing. It's actually the same monitor that our medic units carry. What we have here is a EMS kit. We have an oxygen kit. We have a suction device. Again, all the same things that our medic units carry. And the reason that we have them on Med 1 is because part of our job is sometimes we respond with the medic units. But typically we'll respond on bigger calls, we like to say, on cardiac arrest. We respond to structure fires, we respond to any kind of shooting situation. And our bosses have given us the latitude to add ourselves to calls where we think we might add some value to the call. So because of that, we have a whole variety of things in here. As you can see, it kind of stands out right here. This is a tactical vest and tactical helmet, and we wear that when we feel like there's a possible threat to ourselves. Up here we have these are called P100 masks, and these have been new since the COVID pandemic, and for the past almost the past year we've been wearing these on all of our EMS related calls for PPE protection. So let's walk around to the back. All right, here's some other fun stuff. You may be familiar with this. This is typical bunker gear. I'm happy to get this out and go into more detail if you like. You've seen this on all what firefighters generally wear. This is an air pack, and the reason that we have this is because Med 1 does respond to structure fires as well. I'll go into that a little bit more, but it is part of our job to respond to structure fires, and of course we have to have all the proper PPE just like a firefighter would on a fire engine. For structure fires, we always set up a rehab group, and what that does is that we're here to take care of our firefighters. And so when they go in the fires and they, you know, expel a lot of energy and they get hot, sometimes they get cold. If it's cold outside, what we set up an area for them to come and rest and to get some liquids and nourishment. And then we have a group of firefighters, paramedics, and then we section them off and we take their vital signs. And so if we really try to make a good point to make sure that we're taking care of our own. So if their vital signs are out of limits, we make them sit out and rest a little bit longer. And then in some instances, they even need to be transported and taken to the hospital. It doesn't happen too often, luckily, but this bucket has all the things necessary to do in there. What this is this is our rehab bucket. And I'm gonna just point out some unique things that we have in here. What this is called a Massimo pulse oximeter and carbon monoxide reader. And what this does is you insert this on your finger and you're able to tell how much oxygen is in our blood. And then also what's unique to this is it checks your carbon monoxide level. And that's important because, as we all know, in structure fires, fires create carbon monoxide, and we want to check and make sure our firefighters are within normal limits as far as that goes. So we have a carbon monoxide detector there. We have, of course, this is just some of the things that we use. We have a blood pressure cuff. We have a stethoscope, again, to check people's vital signs. Here, this is interesting. These are some fire wipes, and it's real important to us. When we go to structure fires, we have noticed that you come out of a fire and you've got black soot, whether it's around your face or your neck, and that's all very harmful for us. And what these wipes are for is to wipe your face off, to wipe your neck off, and all the areas that were exposed. So we carry some extra wipes here. So one of the other sheets is, we talked about the rehab, and what this does is this is just a chart that helps our firefighters, paramedics, and it helps the ARPs too that are going through, and we can kind of look at the flow chart and see, what vital signs are normal and what signs do we have to say, hey, maybe this person needs to take a pause and sit down and get some nourishment. Then we have a system that we've used for quite a while, and what this is a rehab tag. So we put people's names on here, we check, make sure their vital signs are okay, and if they're having any issues. And what this is just a way for us to track our firefighters as they go into the hot zone and then they come out. So that way we can have record of it in case we ever need it again. So that's the majority of the bucket here. One thing I would like to mention too with rehab, we started recently using the Arapahoe Rescue Patrol. And so they've been a huge part of rehab for us because they come in and they've been great on working with the Med 1 and the EMS supervisors on assisting with rehab, getting vital signs for us, and just working in collaboration with the fire department. And it's great to work with them. Okay, and so I was explaining some of the equipment we have, and one of the things that's unique to South Metro Fire is we are using an ultrasound machine. And what that does, here I'll actually show you it right now. And I mentioned before that Med 1 goes to cardiac arrest. If we're in the vicinity of a cardiac arrest, we'll go to that. And the reason that Med 1 goes with a medic unit and a suppression unit, and if Med 1's not close, they'll send a battalion chief instead. So it's strategically placed based off of our dispatch center. And so our role at that is really to be of assistance wherever we can. So generally when I get there, I go to the crew and to the officer and I say, hey, what do you need? And 9 times out of 10, it says, they say, well, can you work with the family? So typically, there's family members there. And so what our job is to go maybe get a history or to comfort them at this time was really hard. So what our members have said that it's really helpful for them to have a person there to deal with the family and to help them out while they can take care of the patient. So speaking of that, one of the things that we have is this is an ultrasound, and this is newer technology that I don't think any other fire departments are using right now. And what this is, we can turn it on here and we can actually place this probe on somebody's body, and what we're able to do is we plug this into our phone and we have a screen so we could see if there's any movement in their heart. So one of the challenges we have as paramedics is when somebody's heart's not beating and we're doing CPR, we we come to a crossroads where we say, well, are we going to transport this person to the hospital, or do we feel like our efforts are futile and it's not going to really be of any significance? So with the ultrasound, this allows us to put basically a camera, just kind of like they have in the hospital, and we could see if the heart has any movement, any contractility. A lot of times when somebody's blood pressure is real low, it's hard to determine if there's a pulse, or if they're in certain types of rhythm. This really helps us make that decision. And so it's been very successful for us so far as we continue our study, and we're very excited to have it. Continuing on with some of the equipment that we carry, this is a wildland tool that we use if we need to scratch some line. And many people may wonder why we have some various tools on here. And kind of like the fire truck, it's kind of a mini toolbox, if you will. And again, just because of the nature of us being in this small vehicle, sometimes we're able to get to some places that fire trucks can't get, or even sometimes our brush trucks. So this is important. We also have here, if you can see this is called a Halligan tool. And what this is let's take this out a little bit. We generally use this for prying things, and all of our fire engines have this. If we need to get into a door, or there's a million different reasons we have to use this, but this is a Halligan tool. Let's go into some of the other things we have back here on Med 1. Let's see, we have some wildland firefighting equipment, some PPE. Probably didn't touch on that. So this is the kind of gear that we wear if there's a brush fire or a wildland fire, opposed to the gear that we have up here, which is structural firefighting gear. So different gear for different types of fires. And then what we have here, we have a decon kit, and this is unique. This is something that started for us with the COVID pandemic. And what we have here is essentially a battery operated sprayer. And what we do is we put some decon solution in here and we spray the back of our medic units. So we never used to have this, but after the pandemic started with COVID, it was a big concern for us. There's a lot of questions, and we didn't know the best way to decontaminate our medic units after the calls. So what we started doing was using the solution and this gun here, and it works really well. It helps us with the decontamination. It helps us helps our crews feel better, and just lets everybody know that we have clean medic units, because we're going to turn around and use that medic unit on another patient as soon as we get done. So this was one way that we tried to work with the pandemic. Okay, let's open up the back passenger door here. Of course, we have our Lysol wipes. With COVID, we clean a lot, so we keep a bunch of those handy. And what you have here is this is just a various supply of medical equipment that we have some extras. Med 1 goes around the district pretty often, and we always work with other crews. And the reason we have this here is because it's happened on many occasions that crews ask us if we have extra gloves or extra masks or glasses. So we kind of just keep a stock of most commonly used things, and a lot of it is PPE. So that's what this is here for. So again, back here we have some books, some materials, some pre-plans. I don't know if you can get a look at this. We have some more accountability tags for our rehab process. We have some maps, a lot of the same stuff that you would have in a medic unit or a fire truck we have here. Another special radio here that we use on wildland fires. And let's go to the front here. All right, so let you kind of get a shot of that. So one of the things that we have here is our This is our tactical worksheet. Battalion chiefs and the district chief has the same board, but what we have here is the whole tactical worksheet. We have some markers, and the reason that we have this here is because in our job description, one of our jobs is on structure fires. We respond, we meet up with the incident commander, and oftentimes he has us sit in the passenger seat of his vehicle, and we basically keep track of the units that we have on scene. So the way that we do that, if we have an engine company that go through the Alpha side on the first floor, we note that on here. If we have a ladder company go to the roof, or we have a medic unit designated for transport, we can keep track of all that information here. And this helps the incident commander because he doesn't have to worry about this while he's talking on the radio, while he's trying to get a visual on the scene. So we're just an aid and a helper to him, if you will. And that's, I don't know if you want to get a closer look at this. This has many different sheets. This is set up right now for a structure fire, but if we have a brush fire, we can flip the card, and there's more relative things there.
Alpha 5. Female swallowed a pill and
then if we have a dive call, or if we have a tech rescue call, a hazmat call, or an MCI. So we're able to, sometimes we have, we might have a mass shooting or a large auto accident where we have multiple patients. And what that does is we can get a count for, how many patients can go to what hospital, and it takes somebody to keep track of that so we don't overwhelm one system. And typically the Med 1 is the individual that is qualified and that is really well trained to keep track of that. And so that's why we have that here. All right, everybody, that wraps it up for Fleet Friday. Thank you so much for joining us, and we'll see you next time.